Hello. Have you heard of family therapy? Do you know how family therapy can help individuals, couples, and families? This short animation will help with understanding family therapy as a counselling approach for anyone, not just a way of working with families. The animation will talk about what family therapy is, who can benefit from the approach, and how it helps. Firstly, let's start with what you call family therapy. Depending on where in Australia or where in the world you are, you might have heard family therapy called systemic psychotherapy, couple and family therapy, marital and family therapy, systemic therapy, or family therapy. What you'll notice is that all of these names make reference to what we call systems. And this attention to systems is what makes family therapy unique. It's the idea that people don't exist in a vacuum. Everyone comes from some type of family system, and everyone exists in systems like school, work, friends, sporting groups, and communities, just to name a few. Thinking about where people come from, where they belong, and all the different aspects of their life gives a really full, holistic understanding of a person. And that is what a family therapy approach is all about. Family therapy harnesses the big picture to help find resources and solutions for life's changes and challenges, including stress, coping with challenges like bullying, coping with changes like developmental and family transitions, anxiety and depression, eating disorders, trauma and PTSD, grief and loss, relationship difficulties, self-esteem and self-worth, parenting and parent-child difficulties, behavioural problems with children and teenagers. So what is family therapy? Family therapy is a way of thinking and working with whoever it is who has come for help and support. It's what we call a framework for practice. This means it's a type of talk therapy or counselling that takes a particular frame or focus. All helping professionals will have a framework. It's how we understand things and try to help. Some might have a CBT framework, that's cognitive behaviour therapy, or ACT, acceptance and commitment therapy, or an art or play therapy framework, just to name a few. And a lot of helping professionals will draw from a range of frameworks instead of just one way of helping. If you think about family therapy as a framework for helping, then this means that a family therapy approach is about how the helping professional thinks and works with whoever is in the counselling session. That could be an individual of any age, it could be a couple, a parent-child dyad, a family of any constellation, including step families, blended families, and foster families. Or it could be a young person in residential care. It can be for people who live together, or people who don't live together but would like support for their relationship, or who would like to support each other in facing challenges and healing. This busts a common myth about family therapy, that it's just for families. Yes, absolutely, family therapy is for families, and it's also an effective, evidence-based way of working with whoever is in the room. Helping from a family therapy approach involves a change in perspective. A great way to think of this is that family therapy takes a helicopter view. Imagine riding in a helicopter or a hot air balloon and looking down. The view becomes so expansive. You can see so much from this view. And the more you can see, the more opportunities you can identify and the more flexibility you have in finding solutions and ways forward. This is how family therapy helps. As a family therapist, I take the helicopter up to look at the big picture of someone's life. This helps me think about what is happening for the person as an individual and also in their relationships and broader life context. And then it helps me understand how those relationships and life contexts are influencing the way the person or family is making meaning of the things that are happening in life and the things they might be seeking help with. Context is important. When I talk about context, I'm talking about the big picture, the broader considerations in working with a person, couple, or family. You might like to think of the onion metaphor, all the different layers of the onion, including family, work, hobbies, sport, friends, community, religion, and spirituality. All of these different layers are important in understanding where a person has come from. Even more broadly, things like gender and gender role expectations are important to consider. Socioeconomic considerations, culture, and era in time a person's have grown up in is also really important. If you have a family member who grew up in the Great Depression and notice they are thrifty and careful with resources, like food, money, and clothes, you'll have some ideas about how that person's experience of the Great Depression has affected them. And there might even be some thrifty ideas that have been passed down as a family legacy. This is just one way that a person's context can influence not just them, but their family members. So looking at the big picture and considering the person and their relationships and context really helps with opportunities, possibilities, and solutions, as well as noticing and amplifying existing strengths, capabilities, and resources. You could say then that the key defining characteristics of family therapy are considering a person's context, their relationships, and how they make meaning. It's important to understand that these three things are interrelated. So how we make meaning of something is often influenced by our family and friends, community, and culture. Some other key defining characteristics of family therapy are an appreciation of a person's own perspectives on problems and solutions, as well as their resources, competencies, and strengths. This means as a family therapist, I collaborate with the people I'm working with. I might have expertise in family therapy and counselling, but I find the people I work with have their own expertise too. And when we collaborate and take a holistic perspective, that's when positive change happens. Thank you for taking the time to watch this animation, exploring what family therapy is and how it works. If you'd like to find out more about family therapy or my approach, visit my website, subscribe to my newsletter, or connect with me on social media, Facebook, Instagram, and LinkedIn. Thank you.